Back again for another episode of the Grown and Greek podcast. And of course, we got to go over some housekeeping notes. Make sure that you like, subscribe, share, comment on the podcast, wherever you get your podcast. Of course, we're on Apple, Spotify, iHeart, and Amazon. Of course, follow us on social media platforms at Grown and Greek Podcast. And today, I'm so excited to have a friend and someone who's helped me out with some advice, and she's just a beautiful person. But let me give you some bio information. She's a HBCU graduate of Talladega College, where she received her bachelor's in biology, and on to Tuskegee University, where she became a doctor of veterinary medicine. She currently practices at her own privately owned referral-based veterinary dermatology practice, the Alabama Veterinary Allergy and Dermatology Service, and she's licensed in the states of Alabama, Georgia, and Indiana. She's also an assistant professor of veterinary dermatology at her alma mater, Tuskegee University. She is a member, an active member, let me say that, of Alpha Kappa Alpha Sorority Incorporated, and a heck of a stroll and step master. That's a little insight I know about her. She loves to mentor young adults and encourages them to pursue a career in veterinary sciences. Please welcome to the Grown and Greek podcast, my sister, Dr. Tomeshia Hubbard. Hello, hello.
Hello, hello.
How are you?
I am happy to be here.
Happy to have you. So did I cover everything in your bio? Because you have had a lot of schooling.
Yes, you covered just about everything. Yes,
Okay.
a lot of schooling.
Okay. Well, let's dive in real quick. And so, I did some bio information, research and stuff about you. And the word on the street, I preface this a little bit, but the word on the street also is that you are the vet to call if you are a pet parent and you're worried about your pet having like allergies, itchy skin issues, and all of that kind of stuff. So, we're in the change of a season right now. And with every change of seasons, what are like some of the most common but aggressive issues that, pet parents need to be on the lookout for? And, when is the right time to call you?
Yes. So most of the time when the veterinarian, so most of these clients are going to take their pets in to see their normal veterinarian for a skin problem. It may be some hair loss or itching, licking. Usually when they refer to me is when they cannot get the itching, scratching, biting, chewing under control. So that's when they make the referral to my veterinary dermatology practice. And from that point is when I take over and try to decipher what is causing your pet's problem. And so with us going into the spring months, this is really when we start to see allergies starting to cause a problem for pets. So that includes flea allergies. So if the pet is not on flea control and it's getting bitten by fleas and it has flea allergies, that's going to be a serious problem for that pet. Environmental allergies. They can be allergic to grasses, trees, molds, pollens, dust, insects. So if they have environmental allergies, then we may need to decide to do like an intradermal skin test on them to identify what allergies cause a problem and get them started on an allergy serum. And then lastly, we have our food allergies. So a lot of pet parents are not aware that pets can be allergic to things in the food that they eat. So, it could be chicken, which is one of those main ingredients in a lot of over-the-counter diets. Rice, beef, dairy products are all things that could potentially cause your pet to have some of these allergic issues. And so in those patients, we usually see like these reoccurring ear infections, or they may lick and chew their paws all the time. They may have an itchy bottom where they drag or scoop their bottoms across the carpet. So if you're seeing those types of symptoms, then we could be dealing with a food allergy. So I am the veterinary dermatology extraordinaire. So if those veterinarians can't get those problems under control, then they usually call and make that referral to my practice.
How did you get into that part of medicine, veterinary medicine?
So in my third year of veterinary school, we had a veterinary dermatology resident come in and teach us at Tuskegee University. And every topic she talked about and discussed with us, I was just excited. I said,
Mm.
I need to learn more about veterinary dermatology. So all of those topics she discussed when she was teaching her lectures during that time frame, I mean, it just, I guess, blossomed this love for dermatology. And I also said, well, I need to find out if there are any veterinary dermatologists that graduated from Tuskegee University's College of Veterinary Medicine. So at that point, I went on a search to find these veterinary dermatologists that may have graduated from Tuskegee. And there were actually two. And
Oh,
so
wow.
one was Norma White Wither. She was in the New York area, African American female, and the other was Dr. Patricia White, who was in the Atlanta, Georgia area. And of course, Atlanta was closer.
Hmm.
So I decided to reach out to Patricia White, ask her if I could come to her practice and spend some time with her. She allowed me to spend 6 weeks in her practice learning veterinary dermatology. And those 6 weeks were the best 6 weeks of my life because everything I learned in that 6 week period basically helped me to get to where I am now. And so she told me what all I needed to do in order to become a veterinary dermatologist: a 1 year internship, a 3 year residency in veterinary dermatology. And so that's when I started that path. So I went on to do the internship 1 year in Indianapolis, Indiana at Indianapolis Veterinary Specialist. And now that year was tough. That
Okay.
was a tough year for me.
Coming
That
from
one
coming
year,
from the, is it because you come from the south to the north, or all of the above?
all of it. Yes.
Okay.
I mean, the weather, it was like snowing. I was driving a red Mustang convertible
Ooh.
in Indianapolis, Indiana. So, I was spinning all over the place and didn't know how to drive in the snow coming from Alabama.
Mhm.
And so that was crazy, that 1 year. But it took me a few years to get the residency part accomplished. So I applied through what they call a matching program, but I didn't match with any of the universities or the private practices. So the mentor, Dr. Pat White, Patricia White, decided that she wanted to start a residency in dermatology at her practice. And she asked me to be her very first
Oh, wow.
resident. So I took a non traditional type of route to my career. So most people go through that matching program. They match with a university or a practice and they go there and they complete their residency. But in 3 years, I did not match. And so she decided to start her own residency program in her private practice, reached out to me and asked if I would be her first resident.
Now,
So,
do you think that's because of, the exposure I guess you had to that, coming from Tuskegee and it being an HBCU environment, and can you talk about some of that, like what that whole lineage coming through an HBCU means, because you did undergrad, grad, and then now you mentor and you teach other African Americans, black folks, about veterinary medicine. But yeah, can you kind
right.
of talk about that importance?
So, to tell you the truth, I never would have thought that I would end up being a professor at all because, I mean, shoot, I didn't want to teach anybody anything. I was like, hey, can I just learn something? But I mean, in all of the training I received at my undergraduate university, Talladega College,
Mhm.
in biology, it just sprouted into me wanting to do more. So 4 years at Talladega in biology, then transferring over to Tuskegee University. So Tuskegee was the only university I applied to for veterinary school
Oh,
because I
wow,
was
okay,
determined to go to Tuskegee University. I really wanted to go to Tuskegee for undergraduate,
okay.
but they didn't give me enough money to attend.
Oh.
Talladega College gave me that full scholarship, a full ride to Talladega College. So I said, well, I'm going to go to Talladega and get the same biology degree that I was going to get at Tuskegee. So I started at Talladega, got that finished, applied to Tuskegee, and got in my first try. I was
Mm.
like, thank you, Lord. So once I got into Tuskegee, I was like, okay, I'm living my best life. Because
Mhm.
like I said, I definitely wanted to attend Tuskegee University by all means. Got in, did my training. It was a tough road. So the 4 years were tough, especially that first year, that transition into from undergraduate into professional school.
Mhm.
That was definitely a difference for me because I had to come in, I had to study. I mean, it was serious about the studying. Undergrad, I can go to the AKA
Yeah, I was gonna
parties
say you
and I
pledge and
can
kick it.
I can kick it and hang out, but baby, when I got to Tuskegee, it was something serious.
Mhm.
So I had to buckle down. I really had to study just about every day, reviewing notes and everything in order to get through the program. But the first 2 years were the toughest because you're learning the foundation, all of the basic science information. But once I got to that third year and fourth year, where we were hands on with the animals and everything, putting in purpose everything that we've learned in those first 2 years and using my hands to identify what that actually meant and
Mhm.
making that correlation. I mean, I was rearing to go that third and fourth year. So those were the best years of my veterinary career.
Do you think that that environment prepared you, I guess, in a better way with more hands-on, maybe more intimate practice than you would have had you gone to a PW, I guess, veterinary school?
Yes, for sure.
Mhm.
So at Tuskegee, it was different because number one, we didn't have all of the bells and whistles, like the
Mm.
most up to date technologies and equipment and everything. And we didn't have the support staff that you would have at like a PWI. So they have technicians and assistants that can help them. Basically we were doing all of that stuff on our own.
Mm.
So if we had to put in a catheter on our own, we didn't have anybody to do that for us. We had to do our own anesthesia. We didn't have technicians or assistants to do that for us. So I do think that it definitely prepared me to be a better hands-on clinician. I think that I learned so many skills at Tuskegee because we didn't have all the bells and whistles. So we got hands on. We were in doing surgeries,
Oh,
all
wow.
kinds of surgeries.
Okay, so you
So
are a surgeon too.
yes,
Okay.
ma'am. I can
Okay.
I can do surgery as well. I just choose not to. I
Okay.
love the dermatology side
Okay.
more so. But if I had to do a spay or a neuter, yes, I can absolutely do that. Because when you go through veterinary school, you have to learn everything. I
Mhm.
mean, we learned about exotic animals. We learned large animal medicine. All of those things that I don't even use right now because my focus is the skin of the animal.
Mhm.
So yes, Tuskegee prepared me. I was one of the I would say I was probably the one of the top veterinarians in the United States because we had to do everything ourselves. We had to learn it all.
Mhm.
There was nobody there to assist us with certain things. So when you get thrown in there, they're like, "Oh, you got to do the anesthesia." So you learn quickly what to look for. If this animal is taking not taking enough breaths. You know how to adjust your anesthesia to make that work. So now, after graduating vet school, I know what things to look for because I was the person that was making those adjustments. They're not taking enough breaths or they're too deep. Let's turn this down. Let's adjust the oxygen.
Mhm.
So we had to learn everything. And so that made us better, well-rounded
Mhm.
veterinarians than most other schools
Do
because
you
they didn't get all of that experience.
do you know how many Black veterinarians there are in the country now?
I can't give you that exact number, but
Mhm.
I can tell you that 70% of all African American veterinarians graduated from Tuskegee University's College of Veterinary Medicine.
What?
70%.
Why is
And
that? Why is that?
that's
It's the
because
best.
it is the best.
Okay.
And we are the most diverse
Mm.
veterinary college in the entire United States. So our goal is to continue to be the most diverse. So yes, the majority of the students that we accept are going to be African Americans,
Wow.
but we also accept Caucasians, Asians. We have a small percentage of Puerto Rican students that we accept every year. And so you're going to have Puerto Rican students that come from Tuskegee University College of Veterinary
Wow.
Medicine. So our goal is to be the most diverse
Hmm.
college of veterinary medicine in the United States.
Yeah, so I've only met one other um African American veterinarian, and I was floored. But she came in and she had locks and all, and I was like, I'm just fascinated, because you don't you don't see us. And I don't think that I asked her where she went to school, but considering she uh, was here in the state of Alabama, I wouldn't doubt it. But she was just like, she was so sharp, and some of the questions and stuff that I asked her, it was just different. Like, it was a different bedside manner or whatever. um but yeah, so I've always been, fascinated. And I have a cousin. I try to encourage her all the time. She's such a animal lover.
Oh,
And, we've been trying to get her to go to vet school and do her thing and all. But, I can't, I can only do so much. So hopefully I'm going to show her this episode
yes, you can send
so
them my
she can be
way.
inspired. And I will definitely do that. But no, she's been like an animal lover, like overall,
Yes.
since we were kids and stuff. And so, how life, and then motherhood, and she's married and stuff, and all. But I just think that it's what, like you said, there's a testament to the education that you get from Tuskegee that's like no other. And being in the environment, not only is it an HBCU environment, it's a diverse environment, but it prepares you differently, for the
Yes.
marketplace. So, but yeah, so I have a lot of questions. I am not a seasoned pet parent, and I've had some tragedies that have come my way since being a pet parent. But one of the things that was so like alarming to me were all of the diseases and illnesses that you can prevent, number one, but then also that they can be like exposed to. Because like growing up, we had several dogs,
Mhm.
never took them to the vet. They ate whatever we gave them.
Right.
They lived to they were 25 or whatever, and you never knew anything was wrong. But it's totally different now. Why is that? Like, why is that? And how can people better prepare to be, a pet parent?
Yeah. Well, like you said, even when I grew up, I mean, the dog lived outside and they got the table scraps, and, you
Yes.
put the little, the bacon grease over the food to keep
Yeah.
the hair coat, looking good and all that type of stuff. But I think that as, things evolve and change, they are doing different things to the food, preparing
Mm.
it differently. And so whatever they're using now is not good for our pets.
Hmm.
So I encourage owners to, not feed the table scraps necessarily. Now, with my food allergic patients, I will say, hey, you can, give them fresh fruits and vegetables, but nothing that has been packaged or preserved any type of way,
Mm.
because the preservatives in themselves could potentially cause a problem for your pet. But there are so many different diseases and new diseases that pets can be exposed to. It is super important for pet parents to take their pets into the veterinarian on a regular basis, because they could be exposed like COVID. But I mean, pets can get COVID.
Huh?
Yeah, they can.
What?
Yes, ma'am. Yes.
Okay.
Yeah, it's zoonotic. Like, they can get COVID. I mean, it's they call it a different version of COVID. So we call it COVID-19. But
Mm-hmm.
in animals, they call it, oh, why is it leaving me? SARS.
Mm.
But it's COVID and they can get it.
What in the world?
Yeah.
Okay.
Okay. So, yes, animals can get COVID. And then that's just like, if your puppy hasn't been vaccinated, at 6 weeks, 9 weeks, 12 weeks, they can contract parvovirus or
Mm-hmm.
distemper virus. These are things that could potentially be deadly for your young puppies. So if you're not taking your pet to the veterinarian on a regular basis, you have no clue. And then all of a sudden your pet comes up with this bloody diarrhea and vomiting and not wanting to eat and feeling bad. Well, now they've contracted parvo. Now we've got to try to treat these symptoms and save them from this deadly virus that they contracted from somewhere. And it can
Mm-hmm.
live in the environment for extended periods of time. So if you're not properly educated about having a pet, I encourage you not to have a pet because it's just
Okay.
like having a child.
Yes.
You have to take them to the veterinarian on a regular basis, like I said, and get those primary immunizations at 6 weeks, 9 weeks, 12 weeks. They've got to get their rabies vaccine because rabies is something that animals can give to humans. If you get bitten by a
Mm.
rabid animal or a dog that hasn't had their rabies vaccine, we can get rabies, which we don't want.
Right.
So there are a lot of diseases that, uh, pet parents are just not aware of
Mm-hmm.
that could affect their animals. We encourage you to keep them on proper flea control monthly. They need to be on that flea control. The fleas, like I said, can cause that flea allergy dermatitis or flea allergies, or they can transmit other diseases that we may not be aware of. Okay.
Mm-hmm.
Also, they need to be on their heartworm preventative every month. So heartworms are transmitted by mosquitoes. So if your pet gets bitten by a mosquito that's carrying heartworms, that mosquito can give your pet heartworms. And if you don't
Oh
have them
wow.
on the preventative, then those heartworms are going to mature into adult worms, clog up your pet's heart, and then eventually they're going to pass away from heartworm disease. So those are things that we encourage owners to do on a monthly basis. And if you're not going to see your veterinarian on a regular, you're not going to be aware that your pet is exposed to all of these different things that just live in the environment.
So what makes well, I'm gonna ask two questions. The first one is, like food. You were speaking about food and food allergies and things like that, and I know that goes hand in hand. Um what is your best I guess food choice or types of food or whatever that just you know common everyday pet owners should be feeding their pets?
Well, I definitely would encourage, a quality, reputable company like, usually the Purinas, the Heels, the
Mhm.
Royal Canin. Those companies have really good reputations. And so I would encourage any of my new pet parents or those even with older pets to try one of the reputable dog food companies. Now there are some others out there, but the Purina Hills and Royal Canin are probably like the big three.
Mhm.
So I would encourage them to try any of those dog foods. Now, if your pet has an actual food allergy, then those companies are still really good, but you probably want to go with one of their prescription diets. So I usually encourage like a novel protein diet or hydrolyzed protein diet for those pets that have allergies. But still,
No, what are those? What do you mean? What are
so
those?
so a novel protein diet means that you want to choose a protein source that your pet has never eaten before. So if they've
Okay.
never eaten it, then they cannot have an allergy to it. So a lot of my food allergic pets will go on like a rabbit and potato diet. Most pets haven't eaten rabbit. That's
Mm-hmm.
just not something they're going to encounter in an over-the-counter diet.
Mm-hmm.
Some of them will go on a kangaroo-based diet or an
Okay.
alligator-based diet. So we choose a novel protein source because if they've never eaten it, they cannot have an allergy to it. And when I put them on those novel protein diets, it usually helps control their allergic symptoms. So they stop having those recurring ear infections. They stop licking and chewing their paws all the time. They stop having that itchy rear end. So
Mm-hmm.
those problems go away when we put them on those novel protein diets.
What's your favorite animal to care for?
So my favorite animal, I would probably say a dog is probably going to be my favorite because I see
Okay.
them more often. I see a ton of dogs. I get some cats in the practice as well, but not nearly as many dogs. So, my love is for dogs. I have a dog myself. His name is Nino. He's about 13 years old and he has
Oh,
food
is
allergies
he?
himself.
Oh
So
man.
he has to
Okay.
go on his novel protein diet. He has also had bladder stones that have had to be removed. So I have to put him on a novel protein diet and a diet that is so acidic that it acidifies his urine so that he doesn't produce those stones any longer. So, yeah, so he has some issues, food allergies
Wow.
and bladder stones in his history.
Mm-hmm.
So he's a small little snoodle. So a schnauzer
Okay.
poodle mix.
Okay.
Yep.
What makes a good veterinarian in your book?
Well, I think a good veterinarian is a veterinarian that listens to their clients. You listen to their concerns and you address their concerns as they present them to you. I think that, we have to be excellent listeners in order to provide the help that our pet parents need with their pets. So that's one thing. I think that you have to be very thorough. You have to take really excellent histories that involves listening again. You've got to listen to the client and the information that they're telling you about their pet and taking all of that in and then doing a very thorough physical exam to identify what all problems this pet has. So even though I usually focus on the skin, I'm a dermatologist, but I also have to take into account all systems of that pet's body. So I may miss something. This pet
Mm-hmm.
may have something going on systemically inside, but if I'm not paying attention to the eyes, the nose, the mouth, the teeth, the entire body, palpating the abdomen, looking between their toes and, looking in the ears, I may miss something that the regular veterinary sent them to me for this problem, but I may identify something else that's going on with the dog that the veterinarian may have missed. So I
Mm-hmm.
always tend to do a very thorough physical exam. So I take that history and physical exam information and I come up with a list of differential diagnoses for that particular patient. Once I've got those differentials, then I know what diagnostic tests I need to perform on that animal to determine what is going on with them. And then once the diagnostics are done and I have my test results, then I know this is what I need to do to treat this animal to get them better. So
Mm-hmm.
it is a whole process from start to finish, but being an excellent listener is at the top of the list. That's the only way I can do my job efficiently and effectively because the animals can't tell us what's wrong with them.
Right.
So the
Right.
owner has to tell us that information. So
Right.
I have to be an effective listener in order to do an excellent job and be the best veterinarian that I can be.
So I didn't, I've had like I said, some a tragedy that just I'm still not well
Yes.
from. But what I didn't realize was the extent of the expenses,
Yes.
that comes along with if something like that happens. So, can you just talk briefly, about like some of the ways that people can help with some of the expenses, pet insurance and stuff like that being a part of it. And then I have another question
Okay.
for you.
But yes, so animals do have pet insurance. So there are different pet insurance companies, some better than others. But you can have insurance for your pets. So most of the time, the insurance companies will pay for those routine things that they have to have on a regular basis, like the vaccinations, their annual exams, the heartworm tests, things that need to be done annually. They will usually pay about 50% of those charges for you. So you'll get about 50% of your finances back when you take them in and if you file a claim on their insurance for those particular services. But yes, there are also some other programs available like Care Credit that you can apply for. So if your pet comes up against an emergency, let's say your dog gets hit by a car and you
Mm-hmm.
take it into the emergency clinic and they say that you're going to have to pay $5,000 to get your pet repaired. It requires surgery and oxygen and all of these other things, fluid therapy. Well, Care Credit is something that you can apply for. It's basically a line of credit and they usually give you a certain amount of time interest free. So
Mm-hmm.
you won't have to pay the interest on it. If you pay that bill, if you get a 6-month promotion, then if you pay that bill within 6 months, you don't pay any interest on it. So you're just paying what you borrowed from them.
Mm-hmm.
But that is an opportunity for a lot of clients. And Care Credit can be used for humans as well. So, if you need some cosmetic dentistry or cosmetic surgery, so if you get approved for Care Credit and you have it for your animal, you can also use it for yourself. But we encourage a lot of clients that are having financial difficulties to apply for Care Credit to see how much they get approved for. And you can get approved right on the spot. You can do a
Okay.
pre-approval and it tells you, okay, you got approved for this amount. And then they'll give you like a account number and you can use that right away, like the exact same day. So there are some options available. And then, some veterinary clinics will allow you to make payments, monthly payments on your bill. That's not my practice. I tend to have clients pay at the time that they receive the service, or they apply for the Care Credit, or if they have the insurance, we can file the claims for them, or the clients can file the claims themselves. So there are options available. But when you talk about having pets,
Mm-hmm.
it is very expensive. It is like taking care of a child. And I always tell, owners or individuals that are thinking about getting a pet, it is a lot of time involved with that. You can't just get a dog and leave it in a kennel all day, all day long.
Mm-hmm.
No, you have to invest time with your animal. I mean, they have to form their social skills. They need to be exposed to other people because if they're not, then they may end up being aggressive or bite people when new people come around. So you have to socialize your pet. You have to spend time with your pets. You have to train your pets so that they behave well when they're out in public.
What's the earliest you would suggest, like starting training and things like that?
So I probably would say after they've received all of their immunizations, their vaccines. So at that 12-week mark, when they
Okay.
have been fully vaccinated and we feel like their immune system is fully protected, then they can go into environments where around other pets. So, I think 12 weeks is a good age to start training your pet. So you can take them to a actual training program. I think
Mm-hmm.
PetSmart has some training
Mm-hmm.
that they usually do that you can pay for, or you can train them yourselves. You know, invest in your own pet. And not spend any money. But you can train them how to sit, lay down, stay. You can train them yourself on that.
Mm-hmm.
So I would say that about 12 weeks would probably be a good time to start because you want them to start young so they get in a routine of
Mm-hmm.
what you're training them on. So I would say about 12 weeks would be a good time to start the training.
So tell me, what is one of the most interesting cases that you had? What was the outcome, and then what did you learn from it?
So I would probably say the most interesting case that I've had is a chinchilla
Okay.
that presented. So, the chinchillas have the really soft fur, and it's really nice. Well, this particular chinchilla presented for losing fur. It had all this scale on its skin and everything.
Oh,
And
wow.
so I had to pretty much figure out why it was losing its fur and all of the scale. And I performed my skin scraping, skin cytologies, and everything. Come to find out, the chinchilla had scabies. So, yeah, and scabies is contagious to humans. So that means
Oh,
we can get it too. So, of course, I had to glove up after I found out it was scabies. But I treated it with ivermectin. So the owner gave it by mouth on a daily basis until it cleared up and all of the fur came back, the itching stopped, and the chinchilla got all of its fur back. And so the owner was ecstatic that I was able to figure it out. But I mean, the veterinarian that she had taken it to before didn't do the diagnostic test, so they were just trying to throw some antibiotics at it and, hoping it was going to get better. Maybe this is just a bacterial infection or something. But if you don't do the diagnostic test, you don't know what you're treating. So I did
mhm.
the diagnostics and found out what it was that first day and started
Wow.
the pet on the adequate medication to get it under control. And within a month, these people had their chinchilla back with all of its fur.
A chinchilla.
Yep.
What in the world?
Yes, ma'am. So we get all kinds of exotics. I've treated a hedgehog before. I even go out to the zoo, the
Mhm,
Birmingham Zoo. So I
mhm.
treat a fennec fox that has environmental allergies. So I formulate an allergy serum for him. They're actually texting me on my phone now saying, hey, he needs a refill of his allergy serum. So they have to give him allergy serum by mouth every day. So I've been out there to treat him. I've also got two goats that I treat at the Birmingham Zoo as
Oh,
well.
wow.
And they're on allergy serums also. So yeah, I see it all.
So you're doing your thing, you have your own practice, you are, a pillar in the community, you are a representative of AKA, and you
Yes.
you you really do your thing, Doc.
Thank
I
you.
don't call you Doc.
Yes.
But I'm gonna call you Doc for the podcast. But one more question for you. How important, and I guess, how would you encourage other young African Americans to pursue? How and why would you encourage young African Americans to pursue veterinary medicine? And can you just give some advice and what the marketplace looks like, and then paths that they can take so that they continue to foster not only good medical practices in the world, but represent too?
Right. Well, one of my primary goals is to get more young men, African American men and women, because, at this point, veterinarians, African American veterinarians make up only 1.6%
Dang.
of veterinarians in the entire United States.
Mm,
So, yeah, we're way down there. So to see a veterinarian that looks like me
hmm.
is probably few and far in between. Like I said, that 70% is coming from Tuskegee. But what I usually do is, so when we are at Tuskegee, I tend to teach some of the pre-veterinary medical courses so that the the students that are undergraduate students that are interested in veterinary medicine get to interact with me as a veterinarian. So when I teach those courses, I always extend to those individuals, those young people, to come and spend some time with me in my practice so that you can actually get some hands-on experience and see what the life of a veterinarian is like. And so those young people usually come through my practice and they spend, whether it's a day or a week or a month with me in my practice, and that just develops their skills from that
Mm-hmm.
point. So I try to make it a learning environment when they come and spend time with me. I walk them through the cases and I ask them, what do you think about this case? What would you do next? And try to put them in a situation where they feel like they're actually learning something. And I always get excellent reviews. I also do career days at the different high schools. So I graduated from Winona High School. So they always ask me to come back and do, career days. And that's how we get the high school students interested. I also do career days at some of the elementary and middle schools if I'm asked. And so that's how we get our profession out there.
Do you think it's from a lack of knowing that that there are Black African Americans
Yeah.
that are in veterinary medicine, and do you think that's one of the reasons
I,
you just don't see enough?
yeah, they don't see us.
Mhm.
And so I don't think that, in the African American community, a lot of people don't have pets.
Yeah.
So if you're not exposed to pets at a young age, you're probably not going to be thinking about becoming a veterinarian or somebody who can help pets. I grew up with two cats and a dog in my household. Like they
Mm.
lived in the house, which was rare in the
Mhm.
Black community. But I grew up with animals in the house. That's what triggered me to want to become a veterinarian, because if something was going on with my animals, I was trying to fix them myself.
Mhm.
Or going out in the community, the stray puppies. I'm like, Mommy, can I bring this puppy home? Look, he has a hurt foot. She's like, no, take it back. Take it back. You can't keep it. So I did that all the time. If there was an animal hurt, I'm trying to nurse it back to health myself.
Mhm.
So, we've got to put ourselves in spaces to expose our young people to these careers. It's very lucrative career. And me being a specialist,
Mhm.
even most of my Caucasian clients are like, we had no clue that there was a such thing as a veterinary dermatologist. They had no clue. So
Wow.
they went to their vet and their pet had these skin problems for this extended period of time. And they're like, I'm tired of going and getting the same medicine every time and it's not working. My pet always end up, in the same spot. So they get on Google, they Google and said, veterinarian that specializes in hair loss in dogs or itchy dogs or something. And then I pop up and they're
Wow.
like, oh my goodness, I should have come to see you 5 years ago. I've spent all this money with my vet. I had no clue that there was a such thing as a specialist for a dermatologist for animals. But clients, I encourage clients. I'm like, everything that there's a specialty for in human medicine, there's just about a specialty for in veterinary medicine.
Mhm.
So, and animals can get the same diseases we get. They get diabetes, you know, they get hypothyroidism, you know. Clients are just not aware. They can have high blood pressure. You know,
What?
yes, all the
I'm
stuff
st-
we
you know,
get.
I'm still learning, so I hope not. But
Yes.
I'm still learning. That's wild.
Yes. So
That is
I
wild.
try to do everything that I can to expose our young people to these opportunities. And I would say, if you have an interest in something, you need to align yourself with somebody that is in that field. And,
Mhm.
if you don't feel comfortable with the first person, find somebody else. You know, there's somebody out there that can help you. So I started going into veterinary clinics in high school. When that fourth year of high school and they let you out of school early to
Mhm.
go and do a co-op or whatever, I was at the veterinary practice. So I started off cleaning kennels. I was cleaning up the poop and, wiping down stuff and walking the dogs outside and all that. That's how I got started with an African American veterinarian named Dr.
Wow.
Branch, Dr. T.C. Branch. We're still friends to this day. Still one of
Wow.
my mentors. And then when he closed his practice down and moved over to the other side of town, he hooked me up with another African American veterinarian, Dr. Jerome Williams, who was right off Green Spring. So that was closer to me. So then I switched from Dr. Branch's clinic to Dr. Williams' clinic. Still my mentor to this day. We still talk to each other on a regular basis. So you form those relationships and you continue those relationships. We help each other. So if
Mm.
there's something that they need to know about Tuskegee University College of Veterinary Medicine, they're going to call me. Hey, Dr. Hubbard, can you help me with this? So I mean, the career path just continued. And I now serve as a board member of the Alabama State Board of Veterinary Medical Examiners. That's one of the highest positions you can hold as a
Wow.
veterinarian in your state. And so we review cases from veterinarians, like if clients are saying that a veterinarian didn't do right by their pet, then we have to review those cases and determine if the veterinarian is in the wrong. And we have to bring charges against them if they are in the wrong, or fine them if they're in the wrong, and tell them how they can do better in the future. So I mean, just everything that I've learned along the way has gotten me to where I am today. And all of my mentors have, instilled everything that I have in me. And so I want to pass that down to my mentees. So I have
Mhm.
tons of mentees. They're everywhere. Mentees in veterinary dermatology. I just left the veterinary dermatology conference in Orlando, and I got to see probably about 7 of my mentees that are
Wow.
now practicing veterinary dermatology, that are getting their board certifications. And it was just amazing. They call me Mommy Hubbard
Mhm.
because, they were my mentees. I'm their mentor and they love me. They tell everybody, hey, she's the reason why I became interested in dermatology. She's the reason I'm a dermatologist now.
And
So,
they look like you.
yep,
That's the main thing. They look like you.
yep.
So what's next for you? And then how can people reach out to you and keep in touch with you?
Right. Well, I am planning to stay at Tuskegee University, potentially moving into a more full time position here.
Okay.
So I am thinking about maybe doing some more things that are education related, maybe doing a master's or PhD in educational leadership to see if I can move in a direction of potentially becoming a dean of a veterinary college.
I see it.
That's something that I
I
can
see it.
see in the future. Yeah. So, maybe getting some more training, like I said, in educational leadership and leaning towards that way. But as far as how you can contact me, you can reach me at my veterinary practice, the Alabama Veterinary Dermatology Service in Birmingham, Alabama. So the office number is 205-218-2707, or you can reach me via email at alvetderm. So that's ALVETDERM at gmail.com. And if you're interested in reaching me at Tuskegee, I am at thubbard at tuskegee.edu. So you can reach me if you need to. And I'm here. I'm open to
Well,
all of the
so
young
so
people.
the next part two of the conversation, we're gonna have to talk about all the accolades and stuff that you've won being a step and stroll
Oh,
master.
yes, for sure.
Because you be killing it.
Every
You be
year,
killing it.
every
Killing
year. Yes.
killing it.
Thank
So
you.
that's one hat, and then the other hat is the fun part, the one that you can see you let your hair down, so to
Yes.
speak, and get it. But
Yeah. I always have a lot going on.
yeah.
I stay busy with AKA, with Tuskegee, with my practice, and with my 5-year-old son. So, yeah.
Well, I am just so elated and thankful that accepted the invitation to be on the podcast. I admire you, as a sister, but I, definitely admire you as being someone who is driving the marketplace to be a better place for not only today's, D9 and for, African Americans, but to give someone to look up to for young folks. So thank you for the work that you do. Thank you for being on the podcast. And we're definitely gonna do a part 2 so we can talk about the step and stroll part.
For sure.
But everyone, thank you so much for listening. Of course, you make sure that you like, share, comment, and subscribe to the podcast on podcast platforms, Apple, Spotify, iHeart, Amazon, or wherever you get your podcasts. Of course, follow us on Instagram, Facebook, all the social media platforms. You can watch full episodes on YouTube. And I want to give a big shout out, and I want to dedicate this episode to my sweet pepper. And thank you, Misha, for everything you did for me during that time. But this is just awesome, and I thank you so much for being on the episode.
I appreciate you inviting me.
You can support Grown in Greek by subscribing to the podcast, shopping our exclusive luxury accessory line, or purchasing books from the D9 Book Club by visiting our website at growningreekpodcast.com. Don't forget to like, comment, and share on social media at Grown in Greek Podcast. Thanks for watching.